to everyone in this important dialogue today, in this important webinar today, Food for Health from Greed to Care. I'm really very happy to be in this conversation, and let me introduce myself first. My name is Nicoletta Dentico, and I lead the Global Health Justice Program of Society for International Development. I've had the privilege of organizing this webinar today with also my colleague Magdalena Ackerman, who of course is in the call today, and also with Emma and Alessandra, who have been the important young energy feeding this conversation today. I also want to acknowledge the very important work that we have done with the Rosa Luxemburg Foundation and the O'Neill Institute of the Georgetown Law School. The building of the creation of this webinar has been a tremendous teamwork that has been conducted so far. So I truly hope that the webinar will keep up the collaborative spirit that we have seen today. I feel truly privileged to weave the conversation on this crucial topic, the interconnection between health and food, and that's the first reason. It is a very crucial topic. The second reason why I feel extremely privileged is because we also have such important, eminent protagonists to talk about this issue. People that are really in their hands, in their heart, with their heart in this topic every single day. Namely, we have two special rapporteurs of the UN, the rapporteur on the right to health and the rapporteur on the right to food. I will present them in greater detail later. We have the Vice Minister of Health of a country, Mexico, that is really trying hard to drive policies in the right sense of direction. We have a world-renowned environmental thinker, and also we have a young jurist, a young global health lawyer and a researcher who not only works in academic settings, but also works with countries to bring regulations and to push for a regulatory, the promotion of regulation when it comes to dealing with the industrial sector that has so much to do with food. So we are trying to tackle this very complex topic from different angles, different perspectives. And I think this is going to be the beauty of this conversation today. We are presenting here to the wider audience the latest report that Dr. Tlaleng Mofokeng, who is the rapporteur on the right to health, has prepared, and she presented the report at the General Assembly of the UN. We are now trying to reach out to various communities of actions, academic expertise, but also people that are working in health and food to present and illustrate the very important points that this report is making with, I would like to say, a very strong feminist perspective and activist perspective that is to be read through the lines of the report, and also with a very peculiar but fundamental intersectionality glance into this problem, which is actually often neglected. Let me just make a couple of comments on how we situate this dialogue today. We cannot ignore that we are having this conversation while COP28 is is going on in Dubai. We know that climate change is driving hunger like no other phenomenon previously in history. And it affects disproportionately precisely those populations that have least contributed or that have not contributed at all to the CO2 emissions so far. So this is the first element that we need to consider, the first contextual element that we have to consider. COP28 in Dubai is tackling for the first time the issue of the connection between climate change and health, but also the connection between climate catastrophe and food systems. So we cannot ignore that this is going on while we are having this conversation. And another unavoidable element to contextualize our debate today, I think, is the horrific aggression that the Israeli army is conducting against the Palestinian population in the Gaza Strip, where people have no place to go and no possibility to escape from the collective punishment that has wreaked havoc on their livelihoods, including access to food, access to water, access to healthcare. And as we speak, bombs are being dropped. So that's also something that we cannot ignore while we are having this conversation. And it is important, I think, to precisely situate this dialogue in the arena of growing challenges that the world is facing, but unfortunately after the pandemic, of growing warfare that the world is facing. Now, before I start the conversation with the panelists, let me give you some ground rules for today's discussions. Participants in this webinar are kindly asked to keep their microphones muted, except when they want, of course, to take the floor at a later stage for the Q&A, and when they have to make an intervention, but at a later stage. We have interpretations in 4 languages, which is English, French, Spanish, and Arabic. By the way, if you are chasing for the Arabic translator, you should actually click under the Chinese language. That's what we have learned from Michael Fakhri. He has informed us that if you are looking to have the translation into Arabic, please click Chinese language. And because of the role of the interpreters, of course, we will have to make an act slowly so that they can do their job properly and translate what is being said. You are, of course, more than welcome and warmly invited to insert your comments or questions that we will share and take up after the panelists have made their first round of interventions. We have considered about an hour for the interventions, and then we will have 30 minutes for the Q&A. Of course, you're also allowed, if time permits, to also take the floor and perhaps express your question vocally, but we'll give priority to the written question in the chat so that we can take it up and share it with the speakers. As I said, we will have roughly about 30 minutes for the speakers, for the Q&A, for your answer, for your questions, for your reflections, comments, and then we will give the speakers another round, and also sometimes for concluding remarks. So without any further ado, I would like to start introducing Dr. Tlaleng Mofokeng, who is, as I said, the United Nations Special Rapporteur on the right of everyone to attain the highest standard of physical and mental health. It is good to express the right to health in all its, very ambitious and all-embracing conceptualization. Dr. Tlaleng is a globally renowned medical doctor and a best-selling author of Dr. T, A Guide to Sexual Health and Pleasure. She's also the co-chair of the O'Neill Lancet Commission on Racism, Structural Discrimination, and Global Health. Dr. Tlaleng was named the BBC Top 100 Women 2021, and I'll then give her the floor to start and present her report to us all. Dr. Tlaleng, the floor is yours.
Thank you so much, Nicoletta, for that, and to everyone for convening us all. And I'm especially excited, of course, to be joined by my colleague, Michael Fakhri, who's the Special Rapporteur on the right to food. And I must say that I've been inspired, of course, in many ways throughout my career as a medical doctor, and seeing, firsthand the impact of food insecurity on clinical outcomes. But it is directly because of his inspiring work in the mandate of the right to food that I've actually found this moment to be opportune to do this report that intersects between the right to health and the right to food. And of course, I presented this report in October to the General Assembly 78th session, as you rightly said. And of course, while the 2030 Agenda for Sustainable Development, in particular, goal number 2 aims to end hunger and malnutrition and promote sustainable food systems, we know that food insecurity, or the lack of regular access to adequate, safe, and nutritious food for normal growth and development, as well as an active and healthy life, affects more than 2.4 billion people, and 800 million of those experience hunger. And so for me, it was important to locate food and the discussions around food and the right to health within a human rights perspective, but also highlight that food is a powerful expression of both the self and community, that food embodies cultural, political, and economic value, and that it is also a vehicle for transmitting cultural traditions and identities, especially for groups who are marginalized by race, ethnicity, language, or religion. And for me, I was taught by historians, my medical ethics and medical anthropology. So that contextualization was so important for me, but also in my own family and my own traditions and some of the choices I'm making on food. I know they are influenced by my own cultural traditions, my identities, definitely political, economic context as well. But I also know, as a childhood survivor of apartheid in South Africa, that there are particular identities for myself as being a person who's racialized Black, who grew up in South Africa, and what that meant for my own access to nutritious, safe, adequate food in my own growth and development as a child. And so the report examined how inequities in food, nutrition, and related clinical and health outcomes reflect power asymmetries at every level of society. For me, it was important to use the lens of clinical and health outcomes to distinguish this from what would just be an amazing report by Michael, who's doing the right to food. I had to make it make sense why the Special Rapporteur on the right to health is interested in food. And many a times, my own colleagues in the health sector, in health systems, as clinicians, don't pay sufficient attention to the impact of food security and access to food in the ability of our patients to adhere to particular treatment, to be able to take the medicines in the ways that we prescribe. We always say, take this antibiotic 3 times a day with food. And we are making assumptions about access to food for people. When people are diabetic, we say, take your insulin, make sure you always have a snack around with you for hypoglycemia. What does that actually mean for people who live in particular contexts? And so it was then important for me to then center these inequities around food and nutrition and related health outcomes within a human rights approach, grounded in substantive equality, because substantive equality as a concept demands of us to question the power dynamics and the power asymmetries that exist. And to go a step further, intersectionality in its true sense of what Professor Kimberly Crenshaw intended, I see it as a bridge to get us to substantive equality, because intersectionality therefore forces us to not only just analyze power and where power lies, but to also analyze and understand that power affects different people located at different locations in society very, very differently. And for many people, such as myself, there is historical marginalization of the self, but as well as my own community. And so these inequities have a lasting pattern of discrimination, but also disempowerment based on, of course, ethnicity, race, class, gender, among other things. And of course, we know that indigenous peoples, for example, women, children, infants, have particular higher risks of malnutrition and related poor health outcomes. And so if we want to tackle malnutrition and related health outcomes, we have to end systemic inequities. And we must be aware that the social determinants of health such as socioeconomic status, racism, and gender, also shape health outcomes and these disparities. And so the legal frameworks for me are important because it is the right to health and the right to food report, but it's rooted and located within international human rights. And so the legal frameworks play a crucial role, therefore, in regulatory environments that underpin the ability of communities and individuals to have then the equal opportunity. Because the right to health, in how it's framed, it's not just access to healthcare services. It's also about an equal opportunity for a life that is conducive to dignity. And underlying determinants of health are very, very important. And it is through regulatory environments that often disempower communities. And so it's very important then to look at both the global level governance, regional, national, subnational legal frameworks, and governance issues. And of course, we then understand, therefore, that every aspect of the food system, the food chain, from when the seed hits the ground, from when I'm consuming it in my house, that entire chain does actually shape the food environments in which communities and individuals ultimately find themselves, determining whether diverse, nutritious food is available, accessible, acceptable, and of quality. And those underpin the right to health framework as well. And so we know, in terms of health and health outcomes, that malnutrition manifests itself in various forms, including undernutrition, overnutrition, diet-related non-communicable diseases. We also often not talk about the issues of micronutrient deficiencies. And so in the report, I tried to highlight how micronutrient deficiencies have a direct impact on women's health, for example, sexual and reproductive health, people who do get pregnant, who get pregnant already with existing chronic anemia, for example, but also how diseases such as HIV, liver disease, often impact, and of course other gastrointestinal diseases, impact the ability of the body to absorb particular nutrients. So we're looking at the macronutrients, but it's also important to look at micro nutrients as well. And we know that children, pregnant persons dealing with particular communicable infections themselves have a higher nutrition requirement as well. The other important element for me, what was important to highlight in this report, was that the food processing, of course, has emerged as a dominant practice within the food systems, but it has also raised some serious concerns around the ultra-processed foods, and that this nutrition transition disproportionately targeting children, racial and ethnic minorities, and people from socially disadvantaged backgrounds through specific marketing strategies and marketing practices. And so the way in which food is being advertised and encouraged, and particular food types are being marketed and encouraged to particular groups in society, has replicated colonial power structures and relations as well. And it means that those headquarters that are largely in the so-called global north, high-income countries, are therefore then not able to be held accountable for what their practices are in the lower middle income countries, or so-called the global south. These are historically powerful and wealthy corporations operating in powerful and wealthy countries. And so there is an analysis there of power and how this enables the greed and the disregard for human rights that we see as business practice all over the world. And of course, under the right to health, one of the most important things that I recommend, and I've intervened in previous governmental and judicial processes on this, is to advocate, but also give very clear recommendations around mandatory front of package nutrition labeling. This is very, very important to give information so people know the decisions they're making, but also give specifically warning labels which align with states' obligations to protect the right to health, health-related rights, but also states have an obligation to prevent third parties from interfering with the realization of the right to health as well. And of course, we know, I just want to then wrap up my introductory remarks, in that we know that the pandemic, you've spoken about the climate crisis, you've spoken about war and protracted conflicts around the world. It is important to understand that food is being used as a political pawn in a lot of these contexts. We've heard and listened to how agricultural farmlands of particular communities, which are racialized, indigenous peoples, or have a particular ethnicity, are being destroyed. We hear about land grabbing, where investors acquire land on large scale to then turn those into agro-industrial plantations, right? Triggering poverty for the local communities, leading to food insecurity, the loss of livelihoods for these communities as well, but also the harmful impacts on their health. And so we have to look at it completely within the framework of human rights. And of course, as I have tried to do with this report, have very specific analysis in how the right to health can only be realized to the extent that the right to food and nutrition is also realized. And we know that the climate crisis is increasingly leading to food insecurity, but competition for natural resources. And this further drives instability, also leading to conflict in some areas. And we know that with war and protracted conflicts, parties to those wars often use food as a weapon of war by controlling food production, denying their opposition to food, and exploiting hunger and poverty of local communities. And of course, as I conclude, that malnutrition and related health outcomes through food system reforms is central to all of our efforts to meet the Sustainable Development Agenda. And not only just essential to ending hunger, but also important for all of the 17 SDGs. And we need a food policy coherence. We need coherence in food governance, and that the food system itself is critical to improving health systems. And I think that's the biggest argument I was trying to make, that the extent to which the right to health can be realized, the extent to which people can live a life of dignity, does depend to the extent to which they can realize their right to food, and that food is central and it is intrinsically linked to social hierarchies and power asymmetries as well, both in corporations, in household, but even at that individual level. And that it's up to all of us to engage meaningfully with those people most affected by war, by conflict, by climate crisis, by power asymmetries, even within highly developed countries or rich countries, so that we move together towards a transformative but also a lasting change to end hunger, malnutrition, and the health-related impacts on the right to health. And that UN slogan of leaving no one behind truly becomes more than just a slogan, that we live by those principles, but also realizing as we introspect that we have already left people behind. The 2030 agenda has left people behind. And so how do we co-create and co-vision a world together through the analysis of the right to food and the right to health, in which we recenter all of the people who are marginalized? Thank you so much.
Thank you, Dr. Tlaleng. Allow me to say that, as a rather senior health activist, reading your report and hearing you now, having a truly politicized conversation around health, is such a rare opportunity that we get when the health arena is totally focused on a purely pharmaceutical kind of, biomedical narrative that is disproportionately represented in the discourse about the right to health, which comprehends, as you correctly say, the right to food and vice versa. I like the beauty of these two rights, like many other rights of the right to health, is that they are like plants. Their roots are completely intertwined, the one with the other. And thank you so much for bringing about not only the social determinants of health, but also the political determinants of health, the commercial determinants of health, calling a spade, which doesn't often happen. So I think you have given a lot of food for commenting to Dr. Michael Fakhri, who is the Special Rapporteur on the right to food and a professor at the University of Oregon School of Law, where Michael teaches human rights, food law, development, and commercial law. Michael is also the director of the Food Resiliency Project in the Environmental and Natural Resource Law Center. So Michael, it's your turn. Thank you.
Thank you, Nicoletta, and thank you, Dr. Tlaleng. So first, let me start with, I've been wanting to write a report on nutrition, and I'm so pleased Tlaleng did it because I had no idea how to start. I was worried, I kept putting it off for many reasons that Nicoletta identified, which is I knew that I would have to engage with how nutrition and health is often presented in very narrow, technical terms that doesn't reflect the full aspect of human life. And this report, I mean, it just really advances. So not only reflects a lot of what communities have been saying and what researchers have been figuring out, but I think it advances our understanding on how food and health are inseparable. And I just want to start with this. There's a sentence that just or a paragraph that I think says so much, and Tlaleng already said as much. And here, I'll read directly from the report. Food is more than just the nutrition that it provides. Besides being one of the most common sources of pleasure, food is also a social glue. As a concept, food is certainly more than nutrition. It has always been a special and glorious expression of self, culture, and societal, economic, and political autonomy. What a beautiful paragraph. I mean, that's all I need to say. There, I've just read the report. That's all, and I can walk away from that. And another colleague, special rapporteur on environment, David Boyd, he wrote a report on food, which was great. He starts with food is love. So I think we're sort of competing with each other to capture. This is the point. I mean, it's when we want to spoil our children, we feed them. When we want to see a friend, we go out for a meal. When we miss our parents or our ancestors, we cook a meal. There's so much here. And this is why I'm so happy so many different people from different perspectives are thinking about food more and more and more. And the way I sometimes think about the right to food in the same vein is that food is the right of everyone to celebrate life through their meals with each other in communion. That's how I like to start thinking about it. And with all these different, as you see from Tlaleng's report, from my work, from everyone, many people, it's a way of understanding the very notion of community. What do we mean? How do we build community? I often say, community sometimes gets over-romanticized. Community is people we're stuck with living with, and we have to figure out how to live with these people that we're stuck living with. And food is that way of forcing us to come together. Food reflects and expresses our relationship with the land, with water, with our history, and of course our future. And that's what I think this report really highlights in a way that I haven't seen done enough. If we're talking about children, if we're talking about our elders, if we're talking about our community and food and health, we're talking about building that future in a very concrete, direct way. With indigenous people, there's even more at stake because their land is often made more vulnerable. What's at stake more so than many others for indigenous peoples is the right to self-determination itself. It's existential in the deepest way. So in this report, there's a focus on oppression. There's a focus on substantive equality, as we heard from Tlaleng. There's an intersectional analysis with an emphasis on gender and race. And what this does is it allows us to understand how people are made vulnerable. So it's not that people are vulnerable. There's a choice, as Tlaleng said, it's from the regulatory environment that people are made vulnerable, which connects with the very notion that hunger and malnutrition is never a problem of supply. It's never a problem of, is there enough food available? For at least the last 60 years, if not 100 years, on a global scale, there's always more than enough food on a per capita basis. Hunger and malnutrition is always a political problem. It's always the result of institutional shortcomings. And so when we look at the problem, and this report highlights, one is armed conflict. And it's very telling that to understand any war, any armed conflict, it's very important. If you look at food and you look at the food system, that's how you always understand it the most clearly. So when the war in Ukraine broke out, the Security Council invited me to speak on conflict more broadly. That's very rare for the Special Rapporteur on food to present to the Security Council. In the situation in Gaza, in the war in Gaza, there's a debate over what's the right context to understand what's going on. It's very telling that it was colleagues, a Special Rapporteur on health, food, water, and housing were the first to raise the alarm within the whole UN system to say there's a risk here, a risk of genocide. It's because when you look at food, like these other social determinants related to health, water, housing, you understand exactly what's going on. The other problem that's identified in this report is corporate power. Corporations are producing and marketing food that makes us ill and eventually kills us. And I've heard it makes me think there's a distinction one can make between food, good food, nutritious food that makes us stronger in the fullest sense, and edible commodities, which is what I think these corporations are making. And there's a solution in this report. It's a focus on governance, a focus on policy coherence. And so when we think about health, we think about health in this broad way that we've heard from Tlaleng. And we also think of environmental health. So it's not just within the body and the body itself, and the social context of who we are, but environmental, we cannot separate. Just like the biodiversity of the soil and the biodiversity of our gut are linked, are truly linked. And so national governments have an obligation, and this report outlines their obligation on how they can respect, protect, and fulfill everyone's right to health with detail. And so I'll just, my remaining time, I'll focus on the global governance side of things. So of course, when we talk about health, of course, we talk about the WHO. But as Nicoletta pointed out, what's interesting about climate change and the climate change COP is since Sharm el-Sheikh and now, food has been really growing and becoming more prominent on the agenda, but it's contested. And not surprisingly, the minister, I forget which minister of the UAE, invited Bill Gates onto the stage to talk about some deal about food systems and some new fund they're creating, shaking his hand, et cetera, et cetera. Corporations are very excited that food is on the climate change COP agenda because they're seeing it as an opportunity to now produce sort of the green-friendly edible commodities or what have you. And so I think food systems is on the agenda, climate change COP. Human rights is growing on the agenda. And I think a focus on health allows us to connect these things in a way that's very holistic. The report touches upon trade. Of course, we could talk about the Convention of Biodiversity. Where I'll end is where I think we can be productive and active to think in these holistic terms. Since this is a space that's more of a health space, people might not be familiar with the UN Committee on World Food Security, known as the CFS. The CFS is a committee, it's based in Rome. Governments, it is a multilateral space, so it is a political space. And it's where governments come together to develop policy coherence, and they negotiate instruments, so they're doing substantive work. And the right to food is in the core part of the vision of the CFS. So the right to food, and then that brings in all of human rights in to the space of the CFS. So it's a space, it's a rare space where we can talk about food policy and human rights in a productive way. And I think a report like this and a focus on the right to health, if we bring it forward into the CFS more, and the report touches on participation, the CFS has some unique structures. It has something called the Civil Society and Indigenous Peoples Mechanism. This is a space of, it's a space where social movements organize themselves autonomously, meaning they have their own secretariat, they have their own constituents, and they have to negotiate amongst each other and find a common understanding based on solidarity. popular solidarity. It's the only space where I've seen, for example, a reindeer herder, a Sami reindeer herder from Norway, working with a peasant from Palestine over global food policy, with feminist arguments being put forward with an intersectional analysis. So you have this civil society and indigenous peoples mechanism. They then take positions, and they're present in negotiations on this committee. They have the ability to push national and international policy amongst other so-called stakeholders. So the corporate sector is also present, and philanthropic organizations are also present, but civil society and indigenous peoples have a prominent role at the CFS. So I would invite and encourage everyone in the health space with this political sensibility, with this human rights sensibility, to connect more fully. I'm happy to connect you to the food sovereignty movements, to bring you into the CFS to help you navigate, to bring in more comrades and friends, basically, is what I'm recruiting, is what I'm doing. So maybe I'll end there, and thank you very much.
Thank you very much, Michael Fakhri. I'm all open for this recruitment because, you know, the WHO is looking at the pandemic scenarios after COVID-19, but doesn't have this capacity to bring things together. And I believe the beauty of Dr. T's report is precisely because it offers a space and also new interpretative keys that we need to use in the food and also in the health domain to look at things as for their reality, as what they are. You know, food is health, and health is also an effect, consequences of good food. So we need absolutely to rethink and to stop doing what we were doing before COVID-19 in silos, and that's why the report is so important in that respect. And I take your invitation very warmly. And also, of course, with the Sami people, the indigenous populations, but certainly with the role that governments can play, must play, and occasionally do play to do the right things. And so I'm actually now opening up to Dr. Rui Lopez, who is an epidemiologist. Actually, he's a doctor in food epidemiology in the School of Public Health in Harvard, and he's also a medical has also got his PhD in dental health. He has a great experience. Dr. Lopez has a great experience in the implementation of epidemiological studies and also the arena of non-communicable diseases, particularly. He has done a lot of work on diabetes and cardiovascular disease research at the National Institute of Public Health in Mexico. And I am giving him the floor with great pleasure because we are all very much acknowledging the efforts that Mexico is making, and we are really very delighted to have Mexico with us today. Dr. Rui Lopez, you have the floor.
Doctor Rui está con el micrófono silenciado.
Sorry.
Okay, we can hear you.
Thank you very much, Nicoleta. I was trying to share my screen with a PowerPoint presentation. I haven't been able to do it. I need some permit for that, but if not, I will switch to Spanish if I can. Pues muchas gracias. Muchas gracias por la posibilidad de presentar. Si puedo presentar el PowerPoint, pero si no, puedo también dar de manera general la experiencia que hemos tenido en México desde que iniciamos en este gobierno. Recordar que llevamos 5 años en un nuevo gobierno que desde que se instaló, desde la precampaña, puso el punto crítico en separar el poder económico del poder político y del poder de gobierno, con un claro interés de blindar cualquier política pública del conflicto de interés comercial. Y eso fue desde un inicio lo que nos movió a pensar en una política de mucho más impacto en lo que veíamos en el principal problema que teníamos o que tenemos en salud, que principalmente era la enorme y ya desde varias décadas creciente epidemia de obesidad y de enfermedades crónicas asociadas, diabetes, enfermedad cardiovascular, que están explicando en México y en todo el mundo la mayor cantidad de años de vida saludable perdidos. Pero en México, además de este gran problema de salud pública, en donde no solamente era muerte prematura, sino también calidad de vida, costos de atención, pero también tenemos un enorme problema que no hemos podido solucionar en problemas de desnutrición, entendiendo este problema de la doble carga de la enfermedad, donde en el mismo territorio tenemos gente con exceso de peso y sus complicaciones, pero también tenemos poblaciones que aún tienen indicadores serios de desnutrición. Y no solamente eso, sino también en este contexto de la doble carga, los problemas de deficiencia de micronutrientes en personas que están con exceso de peso, pero que tienen también problemas de anemia, de deficiencia de micronutrientes, y que esto los lleva también a complicaciones serias en salud.
Doctor Rui,
Eso es
perdón, doctor Rui, si usted quiere, usted podría compartir ahora su presentación porque tiene acceso a compartirla.
Okay,
sí. Ok, muchas gracias y perdón mi interrupción.
Okay. Let me just... Can you see the presentation now?
Sí, podemos, sí, we can see that.
Okay. Let me just... I don't see it. Ok, entonces esto era lo que teníamos ahora. El problema de salud en esta crisis sanitaria, voy a tratar de pasarlo a este contexto, que es el punto 4, pues lo veíamos también en un problema serio, que el mismo sistema alimentario que estaba produciendo esta forma inequitativa de acceso a alimentos poco saludables o no saludables, principalmente alimentos ultraprocesados, era el mismo sistema alimentario que también tenía, y cada vez más reconocido, un enorme impacto ambiental, con una degradación de suelos, pérdida de la biodiversidad, un porcentaje muy alto de la producción de gases de alto invernadero, y por lo tanto también la transformación del sistema alimentario se convertía en una prioridad para el sector ambiental. Pero también había un gran problema de que el mismo sistema alimentario estaba produciendo una enorme inequidad. Era también una de las fuentes importantes de inequidad, en donde las políticas agrícolas de comercialización, distribución, abasto, están impulsando que en ciertas poblaciones exista una dependencia alimentaria, una falta de soberanía y de decisión de los mismos territorios o de las mismas poblaciones para decidir qué es lo que se produce, cómo se produce y cómo se distribuye. Y por lo tanto, tenemos este escenario de gran desigualdad, donde precisamente los pequeños y medianos productores de alimentos son los que también tienen los mayores índices de marginación y pobreza. Entonces, por eso también desde una política social era necesario enfocar la necesidad de una transformación. Y por último, también el componente de los entornos alimentarios, que independientemente del impacto que tenían en enfermedades, este mismo sistema alimentario lo que producía era un entorno alimentario que no permitía a las personas tener pues dietas más saludables, y estaban condenados o están condenados a tener solamente el acceso a alimentos poco saludables, además de la enorme invasión de publicidad y de mercadeo de alimentos, que era complicado el pensar que las personas pudieran tomar decisiones en lo que se podían alimentar. Entonces, esto fue lo que nos presentaron desde la academia en este libro que estoy señalando en la parte derecha, donde el Instituto Nacional de Salud Pública, además de enfocar en la necesidad de una transformación en la política de salud, sí puso el enfoque en el sistema alimentario como el enfoque de la política intersectorial, y también durante ese tiempo tuvimos la fortuna de que el mismo grupo de Eat Lancet produjo este número especial en donde también habló de la necesidad de que las dietas o las recomendaciones de dieta tuvieran la visión no solamente de la salud humana, sino también de la salud planetaria. Y es por eso que desde el inicio y el 14 de febrero, pues instalamos un sistema, tomando en cuenta esta complejidad que tiene un sistema alimentario, donde tenemos que verlo no solamente desde la producción hasta el consumo, sino todos los contextos de políticas, gobernanza, regulación, mercadeo internacional y local. Era importante el establecerlo como una política de Estado intersectorial. Salud fue el que empezó a tener, el sector salud fue el tener, y el 14 de febrero del 2019, justo 3 meses después de haber iniciado el gobierno, fue que establecimos este grupo intersectorial de salud, alimentación, medio ambiente y competitividad, donde nos sentamos prácticamente todos los sectores de gobierno, pero no solamente los sectores de gobierno, o sea, medio ambiente, agricultura, los de política social, los de política económica, sino también se invitaron a las agencias internacionales, porque sí veíamos la necesidad de que esto era un movimiento que tenía que verse a nivel global, porque el sistema alimentario no solamente se puede regular o modificar a nivel local sin ver qué es lo que está pasando en los comercios globales y en las regulaciones globales. Y fue por eso que FAO, UNICEF, OMS, OPS también se unieron al grupo. Y por último también, pues muy importante tener al sector académico, y especialmente importante tener a la organización social o la sociedad organizada, que venían ya de varias décadas, tanto en el sistema digamos, de producción, el sistema de ambiente y el sistema de salud, con luchas sociales buscando los derechos a una alimentación saludable, y que veíamos aquí también la necesidad de incluirlos, incorporarlos, para que de una manera participativa mucho más amplia podamos establecer esta política. Era complejo empezar desde una política, de tratar de formularla desde un inicio, y fue que establecimos unos grupos de trabajo para tener ciertos enfoques que veíamos prioritarios y también de aplicación inmediata. Mucho de la política lo que se requiere también es tener una implementación y un logro, y no tardarse mucho tiempo en tratar de definir una política de Estado que vaya poco a poco implementándose. Entonces, de manera paralela, uno de los enfoques que vimos de gran importancia era el mover de un etiquetado que tenían los alimentos procesados y ultraprocesados, poco informativo, muy complejo, para nada directo a las personas para que tomaran decisiones, a un etiquetado frontal de advertencia, tomando la experiencia chilena, tomando también un documento muy importante que la OPS definió de nutrimentos críticos, y tomando eso hicimos la política de Chile, pero mucho más aumentada, donde pudimos producir estos sellos de advertencia, son unos octágonos negros que rápidamente advierten al consumidor cuando va a la compra, el poder tener una idea de que lo que está comprando, qué nutrientes, azúcares añadidos, grasas trans, grasas saturadas, también algunos otros micronutrientes, y también incluimos advertencias sobre edulcorantes artificiales, porque veíamos que también esto es un enorme riesgo, y también sobre cafeína. Y fue por eso, ahora, en la experiencia esta, si no lo hubiéramos hecho desde una parte intersectorial, hubiera sido mucho más complicado, porque cada vez que nos movíamos en un sector, venía el sector productivo y pensaba que estábamos violando ciertos derechos, y cuando se vio que esto era del interés de todos los sectores, fue que se pudo avanzar mucho más rápido, a pesar de la enorme resistencia que tuvimos de la industria privada y de la industria de alimentos. El otro componente que creo que es estratégico también como ejemplo fue un decreto presidencial, esto en forma de un decreto que estamos tratando ya de que se convierta en ley, donde también teníamos, o sea, el ejemplo del glifosato como un agroquímico que había estado creciendo mucho en su utilización en todo el campo mexicano, tanto por la agroindustria de gran escala, pero también a los diferentes niveles de producción de alimentos, y que pues veíamos movimiento global para su progresión, eliminación, y fue que el presidente estableció la eliminación gradual, que en el 2024 cumpliremos del uso de glifosato, pero también especialmente vinculado a el uso o producción en México de maíz genéticamente modificado. Eso ahora estamos ampliando ya hacia una ley específica que no solamente tome glifosato, sino también muchos otros agrotóxicos altamente peligrosos, agroquímicos altamente peligrosos, que se han podido regular en muchas otras partes del mundo o prohibir, pero que en México y en muchas otras partes siguen siendo utilizados a gran escala. También tuvimos la fortuna que desde este grupo de GISAMAC nos dieran la oportunidad de coordinar la participación en los diálogos nacionales directo a la cumbre del sistema alimentario, establecer una hoja de ruta. Y me gustaría decir, creo que la experiencia de la cumbre alimentaria, pues creo que para todos tuvo ciertos, decepciones en muchos de los campos en donde aunque se han logrado ciertas coaliciones, sí vemos como que el enfoque global de transformación del sistema se está yendo solamente a las recomendaciones locales, sin necesariamente ver la necesidad de un cambio de paradigma en el comercio global y en la producción global. También recientemente hablaré de ello, publicación de guías alimentarias en este contexto de saludables y sostenibles. Y también estamos ahora para acabar el gobierno, y ahora sí, con toda esta experiencia, con una ley, tanto una ley general y una ley de educación para los entornos saludables. Pero tal vez uno de los logros también que se tuvo es con dos grandes programas que se tuvo desde la parte productiva, Sembrando Vida y Producción para el Bienestar, que acercan tanto insumos como cooperación técnica a los pequeños y medianos productores para producir de una forma más, en esa transición agroecológica y de apoyo directo al pequeño productor, pudimos articularlo también con las políticas de salud. Pero tal vez uno de los puntos en donde fuimos muy insistentes en tratar de entenderlo como la punta de lanza de la política era la política regulatoria. Nos quedamos en esta parte del etiquetado, la parte de la eliminación de glifosato, pero claramente tenemos que dar un paso más adelante. Y voy a poner algunos ejemplos, ¿no? Estamos con esta parte de la iniciativa de ley, pero uno de los ejemplos que siempre me gusta tocar es precisamente el Código Internacional de Comercialización de Sucedáneos de Leche Materna. Como sabemos, este es un código poco vinculante o no vinculante, en donde muchos países se han adherido, pero casi en la totalidad de los países no se cumple y seguimos viendo un enorme impacto de la industria de producción de sucedáneos de leche materna, que no solamente a nivel general, sino específicamente en el sector salud, ha sido una de las barreras importantes para impulsar la lactancia materna de manera exclusiva. Pero si esto se mantiene como un código internacional no vinculante, pues difícilmente se va a lograr, y ahora estamos en la necesidad de transformar los reglamentos de publicidad y de servicios para que este código sea una realidad ya vinculante con sanciones hacia la industria que pretenda tener esta influencia en las políticas públicas, ¿no? También uno de los logros que tuvimos, pero estamos también en una dificultad de hacerlo realidad, es la eliminación de ácidos grasos trans, donde se pensaba que ya podíamos rápidamente eliminar, pero justo en este proceso final de eliminación también tenemos un gran problema de demandas de la industria alimentaria tratando de mantener sus cotos de poder y la producción de ácidos grasos trans para ser incluida en los alimentos ultraprocesados. Y ahora nuestro enfoque en estos últimos meses de gobierno es terminar con esto en una nueva ley. Es una ley general de alimentación adecuada y sostenible que hemos impulsado desde el Ejecutivo, pero también en las diferentes cámaras del Legislativo, para que sea una realidad. Creo que estamos muy cerca, y entre mucho del componente de una política de derechos, también viene el componente de la transición agroecológica, la protección y el apoyo a los pequeños y medianos productores. Una de las cosas que establecimos en esta ley es precisamente cómo institucionalizar el grupo GISAMAC hacia un sistema ya de política intersectorial establecido ya por parte de la ley, para que esto se pueda seguir en los próximos gobiernos. Y una de las cosas que nos ha interesado mucho, estamos traduciendo este GISAMAC a FINSAMAC, que es ya un sistema intersectorial en donde ya tiene un vínculo directo tanto con el presupuesto como con la implementación de la política. Pero una de las cosas que estamos muy interesados es en poder crear un sistema en el que podamos recoger las necesidades que tienen las poblaciones en el territorio. Sentimos que las políticas públicas a veces están creando tal vez mejores ambientes, pero a veces en la parte más territorial, más cercano a las personas, difícilmente se traduce a veces en un bienestar. Entonces, por eso ahora estamos instalando una forma sistemática de crear estos comités de alimentación cercano a las necesidades de la población, para que esto después en ciertos órganos y niveles de gobierno se pueda convertir como el mecanismo para traducir esas necesidades en políticas públicas locales o federales. Y en esa misma estrategia o en esa misma
Dr.
ley se
Lopez,
establece...
you have 1 minute more, otherwise, okay, thank you.
Se establece esta estrategia de alimentación, ya con eso acabo, donde tienen los múltiples sectores, y uno de los componentes claves es el uso de estas guías alimentarias que recién publicamos, donde tenemos 10 recomendaciones claras que permiten articular el sistema alimentario hacia un sistema mucho más saludable. Y solamente me gustaría terminar, establecimos también la necesidad de una red en Latinoamérica. Tenemos varios países que han impulsado políticas regulatorias importantes, pero que sí creemos que es necesario que exista este marco regulatorio global, porque ahora muchas de las políticas de regulación se encuentran con judicialización de estos procesos en la Suprema Corte de Justicia. Nosotros tenemos ahora al menos 5 juicios de las diferentes industrias en contra del etiquetado frontal de alimentos. También tenemos juicios en contra de la eliminación del glifosato. Y si esto no se convierte en un marco regulatorio global mucho más vinculante, similar a lo que se logró con tabaco, pues difícilmente las batallas se van a poder ganar de manera consistente en cada uno de los países. Entonces, la próxima semana instalaremos una red de gobiernos de la región de Latinoamérica para impulsar el uso de un marco regulatorio, tal vez enfocado inicialmente en alimentos ultraprocesados, y así convertir Latinoamérica como la voz de cambio que pueda, esperemos pronto, impactar más a nivel global. Muchas gracias.
Thank you so very much, Dr. Lopez. It is so thrilling to see that you have a vision and you are trying to implement a vision. And of course, you also want to set a vision for regulating the private sector, which is so important, as Dr. T's report highlights clearly. And of course, you're also, highlighting the very many challenges and legal actions that one has to be confronted with when the proper measures are being pursued. And you may not be aware that there was a lot of discussion about Mexico when we met in India at the Earth University at the Diverse Women for Diversities group, invited by Vandana Shiva, who is here with us. Hi, Vandana. Vandana Shiva, who is a world-renowned environmental thinker, an activist, a feminist, a philosopher of science, a writer, and a science policy advocate. She's also the founder of the Nadania Research Foundation for Science, Technology, and Ecology, and president, of course, of Nadania International. As a physicist at the University of Punjab, she has done a lot of studies on the quantum theory, and then she decided to devote all her knowledge on quantum theories towards an ecological view and a highly philosophical view on life, food, and health. And while we were meeting at the Earth University last March, Mexico was clearly in our, in our horizon, in our radar screen because of the efforts that you have precisely mentioned. But Vandana Shiva has written and worked extensively on this connection between health and food and health. So Vandana, we are so delighted to have you here with us, and I give you the floor.
Thank you very much, Nicoletta, and thank you to Dr. Tlaleng and to Michael Fakhri and to Dr. Lopez for the contributions. I have kind of been thrown into the food issue because the violence around it that I witnessed in 1984 in my country. But I then tried to bring my understanding of the quantum worldview, both getting away from narrow-minded Cartesian causation, one cause, one effect, to contextual causation, systems causation, which is how quantum theory deals with it. But increasingly, I am realizing that the issue of food and the issue of health is really about quantum phenomena, but I will not talk about that today. I have literally just arrived 5 minutes after the starting of this dialogue from Dubai. And I'll come to what's happening there. But I think the relationship between sustainability and justice, between the health of the planet and the health of people, are so deeply interconnected. But we've been forced to live and think through a paradigm of separation of the planet, from how you grow food to your status of nutrition and the health of the people. And because the systems, Dr. Tlaleng's report talks about corporate power. Every one of these corporations, I've done so many books on this. My book on the Green Revolution, my book on Who Really Feeds the World, is about the corporations who claim to be feeding the world. Actually, all came out of militarism, of war. And they only have a mechanistic mind. And that's why separation is vital to them. But as was mentioned, COVID taught us that you cannot separate, that the destruction of the forest to grow GMO soya and to grow palm oil is becoming not the big reason for emergent diseases. According to the UN, 300 new infectious diseases have emerged over the last 3 decades since globalization, which is the commodification that Michael talked about, has started. And when we destroy biodiversity in forests, we create emergent diseases. But when we destroy the biodiversity on our farms and in our gut, we create chronic diseases. This is being recognized increasingly. And this mention of ultra-processed food, both by Dr. Tlaleng and everyone after her, I think is such a big issue. The same processes that destroy the health of the people are destroying the health of the planet, because we are part of the earth and we are part of the same ecological processes. At the Copenhagen COP, for that I wrote a book called Soil Not Oil, which was the connection between food and climate. At that time, the connection wasn't being made. And my assessment was 50% greenhouse gas emissions come from an industrial food system, industrial systems of production with fossil fuels and fossil fuel-based chemicals, destruction of forest ecosystems for commodification, food miles, ultra-processing, packaging. All ultra-processing has to have packaging. In India, it was introduced in the name of packaged food, and cooking by the hand was treated as dangerous. All the advertisements was packaged food is safe. Your hands are dangerous. And huge assault on local foods. And that's why I'm so very happy that Mexico is not just resisting GMOs and trying to phase out glyphosate, but also has linked the resistance to GMOs with the local foods, the fact that the president signed the agreement with the tortilla makers to use GMO-free is really, in the country, is gone. What we really, the Dr. Tlaleng's report is contributing to a major paradigm shift. But for me, the interesting thing is, just having been in Dubai, if you read the declaration that 140 countries have signed, they're reflecting many of the issues in Dr. Tlaleng's report. But that declaration is outside the negotiations. One. And secondly, who walks up to the stage to say, I'm going to implement it? Mr. Bill Gates, who's investing all his money in fake food, denying the basic ecological processes of climate change on the one hand and healthy organisms on the other. I mean, every GMO we shut down in our country, in India, from the BT eggplant to the golden rice, they were all resurrected by him 20 years later by financing it, the golden rice in Philippines and the BT eggplant in our neighboring Bangladesh. And it takes my mind back to Kissinger, who, during the Vietnam War, said food is a weapon. And the link that's been made by Dr. Tlaleng about war and food and the right to food and the right to health. It is at the very roots of pushing a food system that doesn't suit the earth or suit the people. And when he said food is a weapon, he said, when you control food, you control people. When you control weapons, you control armies. And the Green Revolution was part of that, of course, with typical double speed, food for peace. And my own work on food and agriculture started with the Green Revolution. And I continued to work with seeds because for me it was unacceptable that seeds be treated as machines invented by Monsanto, even though there are Supreme Court decisions in America that recognize that. Fortunately, India says plants, animals, and seeds are not human inventions. And I just want to share with you some quick data. So we've been saving seeds in India, just like Mexico is saving its heritage. It's a Vavilov center of corn, like we are a Vavilov center of rice. So we just did a comparison of the averages of our indigenous seeds with the so-called modern varieties, the Green Revolution varieties bred for chemicals. And the Green Revolution varieties have always been labeled high yielding. And that high yield word is being used to say, this is what will feed the world, this is what gets rid of hunger. And India's entire story was distorted by this false phrase. It was made to look like we were starving. In 65, we weren't. We had a drought. And we had a dip, and it came right back after the drought. So look at the difference. The calcium is 146% more nutrition in the indigenous seeds. Iron, 135% more. Manganese, 169% more. Zinc, 80% more. Now, not only are all of these trace elements and micronutrients vital to health, they're vital to running our entire metabolism. And even one of them missing somewhere then creates all kinds of trigger reactions. The entire paradigm of industrial farming was based on the idea the soil is an empty container meant for holding nitrogen fertilizers and phosphate and potassium. So we did a study over 20 years of comparing chemical farms and organic farms in our valley, in Dune Valley, where Nicoletta came. The organic matter is down 14% in the chemical farms. It's up 99% in the organic farms. And that's the climate debate. Nitrogen, 22% down when you put nitrogen fertilizers, and 100% more because the soil organisms are producing it for you. phosphorus, but potassium. Zinc is the one that has totally surprised health practitioners. Zinc has disappeared 37%. And you look at all the statistics, how industrial food is nutritionally empty commodity, is full of toxics. So it's not that there is lack of evidence. That evidence is there. And I think the big challenge we really face is, it used to be corporations, but right now, whether it's Paris or it's the COP in Dubai, who ultimately takes over? And the interesting thing is, here are all the countries working on amazing decisions. But globalization has tried to knock food sovereignty out for individuals and countries. And that is what Mexico's standing up for. But the important point is that even the negotiations, laboriously, countries spending huge money, sitting in those halls. What happened in Copenhagen? Obama flies in, brings 4 or 5 polluters, say, why do we have to have a legally binding treaty? Let's knock it down and have voluntary commitments. Everyone talks about Paris, but Paris was the end of the legally binding climate treaty. It was killed in Copenhagen. And that's why President Evo Morales made all of us join to write the Declaration on the Rights of Mother Earth. And since that time, there's only been voluntary commitments. And then there's been these side declarations which don't enter the negotiations. They have no legal status. But they do give the billionaires the power to hijack the system and make it look like this was negotiated. So the 2 big challenges I personally feel we need to address is, first, we don't have lack of evidence. I mean, on glyphosate, evidence is just all over the place, including legal cases that Bayer has lost. Just last week, they lost another 2 billion or something. WHO has shown it was a carcinogen. Courts are recognizing it's a carcinogen. And yet Europe has just extended by 10 years the use of glyphosate. So what do you do when the best scientific research and the best scientific evidence is just bypassed? Because the corporations who control the food system and are denying the health system basically don't care. And the second then is that the intergovernmental system, I know that when the Food Summit was hijacked, I know Michael Fakhri refused to participate. And, Gates took it over to New York. How do you defend an international system when the international becomes the billionaires and the corporations? Yeah. What are the ways in which we reclaim sovereignties and democracy? I think that is the challenge, particularly in the area of food and health, which affects everyone, everywhere. So thank you so much for organizing this. And I'm very happy to be here.
These questions of yours are so universal, so important. I really would like to, for us to keep those in mind. We have little time, unfortunately, but those are very important questions. And let's, see how we develop these huge question marks that you have raised for us all in the discussion. And now I will give the floor to Isabel Barbosa, who is a senior associate with the Health and Human Rights Initiative at the O'Neill Institute and an adjunct professor of law at Georgetown University. Isabel is very engaged in scholarship, in capacity building, and also in technical assistance, as I said at the beginning, that are related to what governments can do in order to regulate the private sector when it comes to food and health. So unfortunately, we are running out of time, but Isabel, you have the floor now. Thank you.
Thank you so much, Nicoleta, and it's an honor to be here in such fabulous company. I had a PowerPoint presentation, but I think what I'll do instead is just offer some brief reactions to what other panelists
That's great. Thank you.
Perfect. And just to situate my comments in the context of our organization, like you mentioned, Nicoleta, I'm based at the O'Neill Institute here at Georgetown Law. I'm a Brazilian lawyer, but I've been working with the Institute for a few years. And in the past 3 years within the Institute, we launched the Global Center for Legal Innovation on Food Environments, where we conduct legal research focusing on regulatory interventions that can improve food environments. And we hope that this research can be connected to litigation processes, regulation processes that are happening in different parts of the world. So that's a little bit where I'm coming from to this conversation. And one of the things that I wanted to comment, and I think reinforcing what other panelists have said before me, is the crucial role of the framework of the commercial determinants of health, which Dr. Tlaleng Mofokeng, of course, included in her report. And just the role that corporations have in shaping food environments, and the role that law sometimes has reinforcing those power structures and those power asymmetries, and also the role that law can have in transforming these structures and challenging these power asymmetries. So that's something that I wanted to bring to the table. And sometimes when we're giving talks, participating in conversations about this topic, we think back. There's a community activist in the state of New York here in the United States. Her name is Karen Washington. And she often, when people ask her about food deserts in the United States, she challenges the term, and she says that instead of food deserts, we should be talking about food apartheid. And I believe that Dr. Tlaleng Mofokeng quoted her in the report precisely because, basically drawing attention to the fact that sometimes we naturalize the way that certain things play out in society and are structured in society. But far from being the result of natural phenomena, they're actually the result of government action or government inaction. And they're certainly the result also of corporate activity and corporate strategies. So that's something that we usually like to highlight from the get-go. And when we're thinking about the food and beverage industry, and I particularly enjoyed what Michael Fakhri was talking about, the differentiation between food and edible commodities that sometimes are placed in the same bucket. But I think when we're talking about that industry in particular, we have two sides of the coin, right? On the one side, we have very aggressive marketing and advertising strategies. And on the other side of the coin, we have very powerful efforts to undermine effective regulation. And sometimes that can take the form of litigation, that can take the form of regulatory resistance and multiple other tactics that have been very well documented. And all of those things, they come into play in the form of price, in the form of preferences that we sometimes think, again, are natural, but price, there's no such thing as neutral prices, right? I mean, they are the product of a series of policies, of a series of marketing strategies. And we also think about preferences sometimes as something natural, ignoring the fact that they are also the product of corporate strategies. And sometimes when I'm teaching in class and I'm making the comparison sometimes between the tobacco industry and their tactics, and also, the tactics that are now being employed by the edible commodities industry, as Michael Fakhri put it. And I show some students the pictures of Mickey Mouse and the Flintstones and Tom and Jerry smoking, which now seems outrageous to, I think, most of us. But we still naturalize the role of characters such as Ronald McDonald's and Tony the Tiger and all of those, the Cheetos, Cheetah. So all of those characters that are still playing a very big role in the way that we become, affectionate towards certain brands and certain products, and they start becoming a very big part of our lives. And all of these things, as governments move towards regulating them, and I think Latin America has been on the forefront of this debate and of this regulatory movement in the world, in Mexico in particular, of course. But some of these regulations have not gone unchallenged, right? And Rui was talking about how in Mexico this has been challenged through litigation and is now currently in the Supreme Court. And I just wanted to take a moment to think about how the standards that are being distilled and put forth in the very important work of United Nations Special Rapporteurs, how that can play and has played a very big role, an important role in domestic legal discussions that are happening either in court or in regulatory agencies. And I actually think that the Mexico example around front of package labeling is a very good illustration of this process. Because in fact, several United Nations special rapporteurs, including, of course, Dr. Tlaleng Mofokeng, I think also Michael Fakhri, sent a letter to the Mexico government in support of front of package warning labels as it had been put forth in Mexico, and now that it has been challenged in court and it's pending a decision on the Supreme Court, really emphasizing how this regulatory measure is an important means to realize human rights, of course, the right to health, the right to adequate food, but also the right to information and other interrelated rights. So that's one crucial example. Previously in Colombia, civil society had also resorted to courts, this time trying to push governments to take this kind of measure, right? In Colombia, an organization called Red Papás a few years back went to court and challenging the government of Colombia to move towards front of package warning labels. So I think both these examples, they show how the law and courts and litigation, they can be used towards a transformative, end. But it also, unfortunately, is used by the food and beverage industry sometimes to thwart change and to thwart regulation. And then just a final example that I wanted to give relates to fiscal measures and how this also can end up in courts. We have a very recent example where Colombian government passed a taxation on ultra-processed sugar-sweetened beverages. And this was also challenged by the food and beverage industry. It ended up in the Constitutional Court of Colombia. And just now, very recently in October, the Constitutional Court upheld this tax. We still have to see the arguments and the reasoning. The decision has not been published yet. It's just a press release for now. But they do also rely a lot on, the constitutional legal framework. I'm sure it has a lot, it relates a lot to the conversations that have been happening at the United Nations treaty level and all of the good points that Dr. Tlaleng Mofokeng very, fleshed out in her report. But I think in general, just highlighting that the standard setting efforts are really important and really make a difference, I think, when these conversations around the legal debates and the litigation debates that are happening in different parts of the world, it can really inform those conversations. So yes, I think I'll stop there in the interest of time, but thank you.
Thank you so very much, Isabel, because I think what you are projecting in your presentation is that as Bill Gates is kind of cheerleading the process in Dubai, we need to really counterbalance this power play with the collective effort of uniting forces between government, civil society, and those experiences of national endeavors to really change the paradigm. That's what Vandana Shiva was saying, is that we are all trapped in the wrong paradigm, and we need to dismantle and to break out this the violence of the paradigm. Evidence is there, and I really hope that through the report of Dr. T, but also through the nexus that we need to better trickle down at the level of the health personnel and also the food constituencies, the nexus between health and food, we can really create new alliances in this arena. I wanted to mention that we have 10 minutes more that the interpreters have kindly allowed us to try and respond to, react to some of the questions that have emerged so far. Well, I will start from Patricia Borja from Ecuador, who would like Dr. Lopez to have your PowerPoint presentations because she would like to see how Ecuador can, take up from your example. But I will like to start with Bill Jeffrey from Canada. His question is, I read his question: the right to food and health have aspects that are civil and political for intersectionality, like discriminatory access to food and health services. But can the speakers comment on the challenges of addressing the economic and social aspects of the right, which often mean implementing legal entitlements that might vary depending on the local context? And Bill Jeffrey is also warning that, of course, there is a lot of emphasis in the Special Rapporteur's report on the concept of ultra-processed food, which classifies food such as red meat, coconut oil, salt, white rice, beer and wine, and other added at home, the so-called culinary ingredients, leaving readers with the impressions that the size of the building in which the food is made are actually, or the unspecified chemical preservatives are used, are killing people, not the paucity of fruits, vegetables, whole grains. According to the WHO and the Institute for Health Metrics and Evaluation, they attribute between 8 and 10 million deaths per year on this food. So Bill Jeffrey is asking to reconsider the perspective, and WHO is planning to publish a report on the EUPF next year. I also have another question here from Ahmed Boran, saying, although food and healthcare are two fundamental human rights, they have become commodities. However, both food and healthcare rights reveal to the rhetorical. The commercialization or commodification of these fundamental rights is one of the most serious issues that we encounter. In this regard, I have lost. In this regard, how can we ensure nutritious food and health care for everyone in society, where the whole system is controlled by the big corporates, which is very much what Vandana Shiva was also, asking. So I leave it at that at the moment. Vandana, I see that you have your finger lift. Please, you are muted. You are muted. We cannot hear you.
The ultra-processed food focus and differentiating it from artisanal processing is for the processing process. But how we grow our food, whether we grow diversity or the same few commodities, is obviously also an element. So the fact that there is a new awareness that ultra-processed industrial food is harmful to health should not be dismissed because it's not talking about diversity of foods. That is an add-on. So I think we spend too much time constantly dismissing each other. And the oligarchs sit there and just say, here's an opportunity. Let's grab it. And I think part of our work is realizing that every bit of the articulation of these diversified rights is necessary. The people who are focusing on methods of production, people who are focusing on processing, people who are focusing on erosion of sovereignty, deregulation, I think all of it is absolutely vital.
Thank you, Vandana. I couldn't agree more. Michael.
On the issue of economic, social, and cultural, I don't think there's a challenge. I mean, that's what we've been talking about all day today, really. I think holding corporations accountable, ensuring popular participation, understanding food in its broadest sense. This is all we've been talking about today. And I think this is an old idea to think civil and political is easier and more universal, and economic, social, cultural is more localized or whatever. I think this is 40 years old thinking. I think right to health, right to food is, what's the phrase, interdependent, all of the food it's the whole gambit. Health is the whole gambit. So the challenge is sort of how do we understand it in that holistic sense and then provide that way forward. And I think that's what this report does. And I'll just add one more thing, sort of implicit in some of the question of what is to be done. It's organize, organize, organize. I mean, what makes the right to food specifically so powerful is the food sovereignty movement that have organized and chose to use human rights as one tool amongst others. And what I hope after with this report and after today and for the movement, that we connect the food sovereignty movement and the right to food community closer to the right to health and health justice and reproductive justice communities, closer, so that we organize and engage with climate change, reduction of biodiversity, which are the existential problems of our time. And my apologies to the interpreters. I was speaking too fast. I just realized. I'm very sorry. But my gratitude to the interpreters today.
Thank you very much, Michael. And before giving the floor to Dr. T, I just wanted to mention, before I forget, it's very important, the latest movie by Ken Loach expresses what Dr. T's report is saying very, very well, and also what you have just said, Michael, about what Ken Loach, recommends as a recipe for health and food, which is educate, instigate, organize. And I think that's exactly what we should be doing in a comprehensive, having the whole gambit, as you said. Dr. T, it's your, you have the floor.
No, thank you very much. And I, of course, agree with my colleagues and the interventions they've just made. And, when you think about why food is important for myself, for example, I'm a medical doctor who has a very specific focus in clinical practice on sexual and reproductive health services. And of course, it's like, why? Why does this matter to me? It actually matters because part of the Black feminist philosophies and theories that contextualize and made life make sense for us within the kinds of oppressions that we had to navigate is this idea of reproductive justice, right? That took the conversation of our autonomy and making decisions about our bodies beyond just abortion access. But it said that not only do we just have a right to make decisions on pregnancy outcomes, but whatever that decision is, if it's about remaining pregnant, it's that those children are born in sustainable, healthy environments where they're able to thrive. And so in my conceptualization of the right to health, of reproductive justice, of sexual and reproductive health rights, and now with food, it's very clear how these human rights are all interconnected and you cannot divide them into bits and pieces, which is why the work that Michael and I do is so important, because our recommendations are squarely based on what are the legal obligations that member states have. And one of those, talking about legal frameworks, is having a national policy that is supported by resources for the realization expeditiously of the right to health. And we know that food is a key determinant, an underlying determinant of health. And so it's a direct link, which is obvious for some of us. But I can tell you that my own colleagues in clinical practice still struggle with my concept of saying the health system is a social system, right? People are getting ill or sick because of particular social contexts. And whether they get better or led to die by the system, it's again a political, socioeconomic issue. And so it's very important to keep bringing these intersections to the fore, but also explaining them, because I thought they were obvious to my colleagues that when they prescribe medicines to patients, they need to kind of know, what kind of food security this patient has. And doctors have a power to label patients non-adherent, right? I can call someone non-adherent to treatment simply because they couldn't take the antibiotic or the TB medication in the way that they need. So when the UN is now negotiating on a TB resolution, when they're negotiating on universal health coverage, when they're negotiating on the next pandemic treaty, there's no way that vision can happen without these very clear links between human rights. And for me, it was timeless and intentional that this report came out at this moment in time, when the UN and the member states themselves are visioning the next agenda for sustainable development. And so, yes, there are legal obligations for legislation, but let's also not forget the conflict of interest in these corporations that then sponsor government meetings, that are present in governmental and intergovernmental meetings as well, in a space that is shrinking for civil society. Whether it's generic medicines for ARVs, whether it's the food parcels for women who are pregnant, Whether it's labor rights for agricultural workers and farmers, it has always been civil society. It's always been them advocating and pushing. And so we need to protect that space of civil society, meaningful consequential participation at all levels. And I think that is what we need to guard against in this current, climate and context. It's that the space is shrinking for true human rights organizations and civil society, and that their impact and their ability to have influence is also diminishing a little bit. But not to end on a sad note, to say that there is a lot of work that is being done, but it's definitely important to draw the threads and to draw the links across all of the social justice movements, whether it's gender, climate, race, all of those. We have to make sure that we thread that common agenda around all of these important issues. Thank you.
Thank you so very much, Dr. Tlaleng. In the meantime, the space for the CO lobbyists is expanding a lot. Corporate accountability has counted 2,500 private sector lobbyists in Dubai. They were 600 in Sharm el-Sheikh last year. And yes, so there's the problems that Vandana Shiva was mentioning earlier, the fact that then you have Bill Gates, taking up much of the wording and the narrative to transform the agenda of food and health according to his own understanding of it. And in the meantime, at the WHO, as the pandemic treaty is being negotiated, the narrative goes that we have to increase the surveillance because the pathogens are our enemies, the microorganisms are our enemies, and we don't consider at all the main drivers of spillovers or the main drivers of those situations that actually create spillover events. So and that facilitate the impoverishment of biodiversity loss, impoverishment of land and soil, which you perfectly nicely highlight also in your report. So I think it's important to highlight that. And also I think another problem is that Dana said that perhaps the Paris Agreement was the end of legally binding arrangements. Yes, that's something that we need to consider also, because I can see that with the WHO pandemic treaty, where a lot of the language is basically, not so binding, or the binding element of it is decreasing each draft of the text that we are confronted with. So your report, as you said, comes at a very appropriate time, and the treaty on the pandemic scenarios of the future is being negotiated now. And I think it is very important to do exactly what you say, also to trickle down this knowledge of the connection between health and food in the global health workforce, where it is not yet so clearly contextualized. The link between food and the clinical consequences of the right food or the wrong food that the world is eating. So I think these are all elements that we needed to take on board. I would, as I see, I don't think I see any other questions in the chat, and I think we are running out of time. I'm just wondering if there is any burning comment. Dr. Lopez, I wonder if you want to, maybe say something. We have a couple of minutes still that I would really like to give you.
Yeah, thank you. Just in terms of the ultra processed food, the focus on regulation, I think it's very important. It's not had to be a fight between increasing access to fruit and vegetables and being hard on regulation of ultra processed foods. Ultra processed foods has been shifting the agriculture production, is been shifting the access to food. So I really think that the focus, the definition and regulation to ultra processed foods has to be a priority, not only at the local level, but at the global level, because are the same private corporates which are pushing the system to produce and increase the access to processed food. So the private sector has a role here, but the main role is to be allowed or to permit that the political actions on regulations has to be followed by these industries, and they have not the chance to be part of the defining the regulations. So as Isabel mentioned, I think the commercial determinants of health definition, I think it would be very useful to push further the regulation against the main drivers of this the food system that we are suffering now. So thank you very much.
Thank you very much, Dr. Lopez. Isabel, if you want to make a final comment.
Thank you, Nicoleta. No, I was just thinking back to the comment about this very artificial division between the civil and political rights on the one hand and economic, social, and cultural rights on the other hand. And I couldn't agree more. I think it's an old distinction. It responded back then to the geopolitical circumstances under which, the covenants were drafted. But one thing that I wanted to highlight is I think there's a misconception many times that civil and political rights don't require resources, while economic, social, and cultural rights do. And that's not a clear cut, right? I mean, when we're thinking about civil and political rights, for example, we can think about elections, and that costs a lot of resources, and we still have an agreement as a society that it's worth investing those resources. And on the other hand, we have economic, social, and political, economic, social, and cultural rights that cost resources and others that don't. The regulatory measures that states can implement, which don't impose a big financial burden on states, others do. But I think this division and this artificial distinction sometimes is misleading, because on both ends, we do have regulatory measures that require resources, others that don't. And states have their obligations to fulfill regardless. So I just wanted to also put this out there. I think front of package labeling is a really good example of a powerful regulatory measure that does not require a lot of resources on the state's end. Taxation is another one that actually increases revenue, right? So I think those are some good examples.
Thank you very much to both you, Isabel, and also Dr. Lopez. We will invite you to Italy, where it seems that any fiscal measure or any regulatory measure related to the food industry is a kind of a taboo discourse, and it is impossible to achieve. So let's actually learn from plans. Let's kind of, connect rights. Let's connect constituencies. Let's occupy the CFS, as Michael was suggesting earlier, with the health groups, but also let's bring the food constituency and the indigenous populations into the health arena. They are simply not there. We don't have the people that actually represent the social movements in the health domain, in the health constituency. Let's support governments that are trying to do their best. Mexico is a perfect example. And let's also support any other groups and initiatives and good practices that happen in the world. The report highlights, features some of these very important practices that need to be they have to be known, and they have to be replicated elsewhere in order to create this mass of action from bottom up. We need to be, the promoters of social poetry and political poetry when it comes to food and health, precisely for the reason that food is what the report says. It's life, it's pleasure, it's actually relations, it's identity, it's why we are on this earth. And it is so important that we are not substituting this with a commodified entity that is built on this triad, on this trinity: sugar, fat, and salt. We have to overcome this. It's going to be a very difficult fight, but I think that Dr. T's report is a powerful instrument. And Dr. T, I really take a commitment on behalf of SID. SID is looking at this systemic approach, and we will definitely, do a lot to promote your work and to promote your analysis and the understanding that you have advanced on this arena, together with Michael and together with all the panelists that have been engaged today. I really want to thank you again for this very important conversation. A dialogue is the beginning of, I hope, much more action together. And I want to thank all the people that have attended this meeting. We need to close because the interpreters cannot stay any longer. I really, really want to thank the interpreters for their work, for enabling understanding and language, expansion of this narrative. And I close it here, thanking also all the people, as I said, the Rosa Luxemburg Foundation, the SEED people that have worked, Emma, Alessandra, Magdalena. I want to thank, of course, Colleen and you, Isabel, for having worked into making this happening, and more to come. Let's unite food and health for food. From greed to care, the care that we want to see for the future. Thank you all. Bye-bye. Thank you. Thank you.
Gracias.
Gracias. Thank you.